Good morning. My name is Debi Flora. I am with GVC, Give Virtual Care. I want to thank all the amazing Salon Republic beauty pros for being with me this morning. I first want to send a huge shout out to Eric Taylor and to Marissa Black for helping put together this incredible partnership that is bringing all of you a brand new lane in healthcare. This is not insurance. This is not, you don't have deductibles or waiting rooms or wait times. You're not going to get a second bill after you talk to a doctor. This is 24/7 access to incredible general medical doctors, all US licensed, mental health therapists, psychologists, psychiatrists, mental health and crisis care immediate access with a therapist, and discounted prescriptions. Again, I want to thank Eric and Marissa for helping forge this partnership. This now puts an amazing healthcare tool in your hands. It could be a Sunday at 3 a.m., it could be Thursday at 7 a.m., and you're not feeling your best. We want you to feel your best because you make us look our best. So we need you out there feeling great and being at the tip top of your health. We're allowing you to do this. I'm going to share my screen and show you exactly what we're putting in the palm of your hand. And keep in mind, this travels with you. It does not matter if you're in California, if you go visit friends in Tennessee or in Colorado, we provide this service for you wherever you are in the United States. You now, because of Salon Republic, have this access, as I mentioned, 24/7. You can talk to a general doctor. Think of anything that's non-emergency, right? Cough, cold, flu, bronchitis, allergies, rash. What's this bump on my arm? All of those things can be handled through a video conversation with a doctor. You can take photos. Maybe it's a rash. Maybe it's a bump. Maybe your knee, has this bruise that won't go away. Maybe your throat is just really inflamed. You can take photos of all that, upload them for the doctor, and have a great discussion. Again, you don't have to leave your pajamas. Maybe you're in the salon and you just are at your wits' end and you just need a little, consultation to find out what is going on, why you keep sneezing, or why you keep getting a headache. Again, you have this service, you go away, you have great care. Maybe you need a prescription. We'll talk about that in a minute. The second portion that we bring to you is mental health, and everybody knows mental health issues are on the rise. People are finally having the discussion. People are finally standing in their own light to say, you know what, I need some help. I'm having some struggles. So there's really two avenues here for mental health care. The first is mental health appointments with licensed therapists, psychologists, psychiatrists, and these are within days. And for anybody that has knowledge of the mental health space, currently, as we speak, the wait time to sit with a mental health provider in a brick and mortar setting in their office is up to 4 months. Not 4 days, 4 months. So if you have an ongoing need, or maybe you have a clinical diagnosis that you need to continue to seek care for, rescheduling and having a 4-month wait time is really extremely long. In most cases, our mental health providers are available within 3 to 5 days. So you now have access to sit with somebody. You can go through the catalog of providers. You can read about the bios of Dr. Sarah, Dr. Joseph, Dr. Patel, whomever, and make a decision that you think is the best fit for you and schedule ongoing visits with that provider. The next piece of mental health is really we call crisis care, but it's really crisis care and mental health kind of put together. This is for those days that you are just suffering with horrible anxiety, or maybe you suffer from seasonal depression. Or maybe once in a very blue moon, something's come up where you've thought of, what if I wasn't here? Maybe it's just a really bad relationship breakup, or just so much stress in your life that you cannot go back to sleep after 3 o'clock in the morning. This is a great time to step in to the light and just start a conversation. And you can do so either via voice, it's not video, or you actually can text and just say, where do I start on this journey? Where do I begin? What can I do to make myself feel better? So that is available to you 24/7 as well, and at no cost. The next part of the portal is our prescription discounts. Maybe you're taking something currently. These prescription discounts are not just for prescriptions you get through the app. They are for maybe something you're taking long term. Maybe you or someone in your family is taking Lipitor, or maybe there's an allergy medicine. You can go into the portal and search that medication name. You now have the power of choice. You can choose if you want to pay for the brand name or if generic is fine. You are no longer dictated based on any type of plan. Again, we're putting healthcare choices in your hands. Majority of the prescriptions can run up to 85% off, and it will show you the various pharmacies in your area and what those discounted rates are. You can set that up and even have free home delivery. And the other great thing that we've brought to you is we realize that healthcare is not one size fits all. It is, we all have different things that we're focused on, different needs we have, different situations in our lives, whether we're single or married or have a life partner or have 2 kids or have no kids or have 7 kids. We all have a different scenario, and we want to be able to give you choices where they fit perfectly into your health scenario. So this is kind of an overview. I'm going to share a few more things, but please, if you have some questions, throw them in the chat. I know something new like this that's like, wait a minute, there's usually healthcare or not healthcare, and you're telling me this is a new lane. And according to the questions, yes, this is. COVID really opened the door for this to be a possibility. Telehealth has been around for 30 years. And COVID, just when we were all staying home, people still needed care. And doctors realized that they could provide phenomenal care via the phone, the computer, virtually. And that is really where Give Virtual Care shines. Is, again, you don't have to go into a waiting room with other people coughing and sneezing and hacking, hoping not to get whatever they're sharing with those in the waiting room. You don't have to be on a doctor's appointment schedule. You can fit these in when they fit with your schedule. The great thing about the general care is you have a choice. I need to talk to a doctor immediately, or you know what, I have 3 more clients. I need to talk to a doctor at 8 p.m. tonight. You have the choice if you want to talk to somebody immediately or make that appointment. Again, we're putting flexibility and we're putting choices in your hand. And think of all of the things that come up, especially when you've gone to the doctor. I don't know about you, but I usually get a sinus infection at least once a year. I have horrible allergies. And when I go, every single time in the past, because now I use my app instead, is they always say to me at the end of my appointment, if this doesn't clear up in 5 days, you need to come back and see us. Well, I don't know about you. I don't know anybody that goes back and does that, because now I'm shelling out another copay. The average copay in the United States right now can run between $30 and $50 for a general med visit. And, paying that is, that's gas money sometimes. Maybe it's food money some weeks, that's weekend money for some of us. So to have something in your hand you can tailor to you at extremely, extremely affordable cost. You actually have benefits, like I said, at no cost starting out. This is really, it's going to help you shine, because as I said, we want you all to be healthy. The great thing is, think out of the box. I actually broke my thumb. Probably it's been about 4 months, and I knew it was broken. A group of athletes I knew was broken. And I went on my app, talked to a doctor, and I said, I think I broke my thumb. He had me move it in different things, asked me where the pain points were. I showed him, I gave a visual, and he simply said to me, I do believe it's broken. Please go on Amazon or to, your local Rite Aid and to get a thumb wrist splint. Wear it for 6 weeks religiously. You can take it off only to shower. And in 6 weeks, if you take it off and you have no pain, you're good. If you have pain, you need to go get an x-ray. And in 6 weeks, I took it off and I was pain-free. And so it just shows you, I didn't have to make an appointment to go get undue radiation. My x-ray place takes about a 2 to 3 hour process to get through. And I didn't have to expose myself to any of that because I had this amazing tool in my hand. And the great thing is, doesn't matter where you are in the United States, again, you have this access. So I'm going to stop sharing this, jump back on to see all you wonderful humans. Um, so think of this really as a doctor, a mental health therapist in your pocket. You can tailor this for yourself. Maybe you're a parent, maybe you have a life partner, maybe you have a boyfriend, girlfriend, maybe you're living with an aunt. Maybe, I mean, all of our families look so differently these days. And the great thing is you determine who your family is and you can bring these benefits to them as well. These benefits are extended to children. You have to be 18 to see a mental health provider, but these services you can jump on, with your 6-year-old who keeps nagging at his ear or keeps, rubbing this spot on his elbow. Instead of, having to stop your entire life and drive somewhere and wait somewhere, you can get amazing care. These providers, our doctor network is are providers for all of the major insurance carriers. So you have access to really best in class. And that is what Salon Republic wanted to bring to you. Again, you guys do amazing work to make us look and feel our best, and we just want to give some of that back to you. So let me see if we have any. I'm peeking over here at my chat to see if we have any questions coming in. I know one of the big questions is, and I will have Marissa send this out to you, is to start. Marissa sent you all an email. It had a link to basically download for free your account, set up your account, start your free benefits, and then it gives you different options on what is the best fit for you. And maybe there isn't one. Maybe right now you're just going to start and check it out, and maybe you're taking a monthly medication and you're going to see how that goes. So again, all the choices. The greatest thing is though, starting is simple. You can even download the app out of the Android or Apple store. Simply put in your email that you correspond with Salon Republic with, and that is the gateway then to begin. For those of you that did see the intro email from Marissa, it does also have a code, so you can simply type in the code and you can get started that way as well. I will have Marissa share kind of the tiered and all the various options with you. But I can tell you that if you or someone in your family has a mental health need, the average cost to sit with a mental health provider, and I'm speaking psychology and psychiatry, can run about $200 per visit with insurance. That is just simply the copay. So if you have someone in your family who has a need, and as I do in my family, my extended family, I have a cousin, then if he sits with someone every week, that's almost $800 per month. And we're bringing you a service that for pennies of that, you can provide this to that person in your family. So an incredible tool. Again, that migraine maybe you've been suffering with, or that we are right on the cusp of cold, flu season, right? Everyone's going to be coughing soon. Everyone's going to be sniffling soon. If you're watching the news, supposedly we're going to have another small COVID surge. There's a full COVID screening within the app as well. You can talk to a doctor and get medication if you are, if you fit the profile for someone that needs that. So again, it just allows you to be the best you. We're constantly at GVC adding tools and coaching mechanisms. We want this to be more of a wellness experience, not just your health, but your overall well-being. So look for some great things down the line to be added as well. We want to be here to help you be at your best with Give Virtual Care. So I don't see any more questions in the chat. Again, please reach out to me if you have any questions. Debi Flora. I will have Marissa share my information with you all. I'm happy to answer anything, help you all get started. Again, there's no cost to start. There's no cost to check it out. We're even offering a trial period so you can, get yourself serviced. Maybe you have a child, maybe you have a roommate, maybe it's your life partner, and they've had something going on that you've been nagging them to get to the doctor, and now you can. Give Virtual Care is, we are the new gateway to the best you. So I appreciate your time. Again, a thank you to Eric Taylor and to Marissa Black. Thank you all to you amazing beauty pros, talented crew you are. I personally am a Salon Republic client myself, so kudos to all of you for the hard work you do every day. And please take care of yourselves. Be well, and thank you.